I'm Vahan Kassabian. I'm Medical Director of Georgia Urology. I have a very strong interest and passion in advanced prostate cancer and urologic oncology in general. And we offer many service lines, one of which is advanced prostate cancer. I love the fact that patients consider this sort of a journey. If we talk about prostate cancer, for example, it is a journey. You get diagnosed, you have all the emotional aspect of what treatment, what side effects are you going to have. And most of the men, we do a very good job of curing prostate cancer. But unfortunately, some men do recur, and a percentage of men will end up having metastatic prostate cancer. In other words, it's spread to other organs of their body. And that's a tough journey. Prostate cancer loves to spread to bone. 90% of men who develop advanced prostate cancer will end up having prostate cancer in their bone. This is not bone cancer that started in the bone, this is prostate cancer that spread to the bone. The definition of metastatic castration-resistant prostate cancer is really quite simple from a medical perspective. It really means that hormones or androgen deprivation therapy are no longer working. And the PSA, the blood test that measures prostate cancer growth, is beginning to rise. The common symptoms associated with metastatic castration-resistant prostate cancer can be very varied. They can be completely asymptomatic. They can be minimally symptomatic. They have a little bit of ache or fatigue. But then as the cancer progresses, they become more serious. So pain is usually a frightening symptom, but it's usually not the first symptom. Usually fatigue, a little bit of not being able to continue with life's duties, perhaps a little bit of change in bowel habits, change in urinary habits, all these little subtle changes that the body will alert the patient that something may be wrong. And it's very interesting because sometimes they happen so slowly and the patient doesn't realize the changes that are happening, but their caregiver, their spouse or loved one, typically will pick up on it, usually a little bit sooner than the patient may themselves. So when men experience symptoms of prostate cancer, they tend to be men. I mean that in a nice way, because obviously I've done it too. We're supposed to be macho. We're supposed to be stoic, and we can never show a sign of weakness. And that's sort of how men are. I always give this analogy. When women go and one of them gets diagnosed with breast cancer, what do? They call their friends, they talk. Who did you see? What treatment did you get? What do men do when they get diagnosed with prostate cancer? They sort of run and hide in the locker room and don't talk to any friends. And unfortunate, because sometimes if we catch them earlier, we can improve their quality and their longevity a lot more than if they wait too long and sometimes it's too late. We're fortunate that in the last 7 years, we've had a lot of advancements in advanced prostate cancer. We are trying to make advanced prostate cancer more of a chronic disease and that patients can deal with it. It truly is an individualized treatment decision-making process for each patient.